Hello, my name is Zoe Quinn-Kelly, and I am Dr. Harkess's PA. So you have been scheduled for a knee replacement, and the point of this video that you're watching right now is just to go over everything. What to expect before, during, and after surgery. And the idea is that you can watch this video as many times as you want, and hopefully it will answer any questions that you might have. But I do recommend that you either grab a piece of paper, take notes, write down any questions that you might have, or alternatively, you can even print out these slides right on the website, right where you're watching this video. It should be right below, and you can take notes right on the slides as well. We will be giving you a call. It will either be me or Dr. Harkess 1 to 2 weeks before surgery, and you'll be scheduled for this, where we can kind of go over any other questions that you might have that weren't answered in this video. So the first thing we're going to do is kind of go over our knee anatomy. So the knee is made up of 3 bones: the femur, which is the thigh bone, the tibia, which is the shin bone, and the patella, which is your kneecap. Now, a normal knee has a nice thick layer of cartilage. This is basically, a cushion at the end of your bones that enables them to move and glide easily. So what happens when you have arthritis in your knee? Well, arthritis is a degenerative disorder of your cartilage. It can happen over just with natural wear and tear over the course of your lifetime, but also from any sort of traumatic accident or inflammatory disorder like rheumatoid arthritis. By far the most common kind of arthritis is osteoarthritis. Now, there are 3 compartments of the knee: the medial side, which is kind of the inside part of your knee; lateral, outside part of your knee; and patellofemoral, which is where your kneecap runs along your femur bone. When you only have arthritis in one compartment of your knee, you may have talked to Dr. Harkess about doing a partial knee replacement. We do these rarely because most of the time people have arthritis that involves more than one compartment, most often all 3 compartments, in which case you've been scheduled for a total knee replacement, which is why you're here talking to us now. So what is a total knee replacement? A total knee replacement is really, a better term for it would be a resurfacing of the articular surfaces of your bone. So we're not chopping out your whole knee. What we do is we first prepare the bone by just shaving a few millimeters off of all the edges. And then we measure metal implants that are basically cemented onto the edge of your bone. We insert a medical grade plastic spacer in between those 2 metal parts that creates a smooth gliding surface, and then your kneecap or your patella is also resurfaced with just a little plastic button on the end of that. So anytime you have surgery, we do have to discuss the risks of surgery. Now, everything that's on this slide is very, very rare. We do not plan on any of these things happening to you, but we just have to discuss them. So anytime you undergo anesthesia, there's always a risk of medical complications, things like heart attack, stroke. That's why it's very important that you get clearance from your primary care provider and your cardiologist if you have one. Now, anytime you have surgery and we do make an incision into your skin, there's always going to be a risk of infection or bleeding. As far as bleeding is concerned, it's why we have you come off of any medications that can make you prone to bleeding, whether that be, over-the-counter NSAIDs or even a blood thinner. We also will be using a tourniquet during surgery to help prevent some of that bleeding. As far as infection is concerned, there are certain conditions that do make us a little bit more worried about infection. If you are a smoker, we do ask that you quit smoking 6 weeks prior to surgery. Anytime you have a higher BMI, that does put you at more increased risk for infection, and especially if you have diabetes. That's why it's going to be really important to keep good control of your blood sugars before, during, and after surgery, and also why we will be checking an A1C before surgery. Now, he will be at increased risk for blood clots after surgery. So we're worried about bleeding beforehand and during, but blood clots after surgery. For most patients, we will be giving you an aspirin twice a day after surgery to help prevent this. If you have any reason why you can't take aspirin or you have a history of blood clots, we will likely use Xarelto instead of aspirin, which is a bit stronger. And if you're already on a blood thinner, we will just put you right back on that afterwards. Now, you'll also be at increased risk, just like a bleeding risk, of things like a hematoma. So that's basically a fluid collection of blood underneath your skin. But we try to make sure that all of your bleeding is controlled before we close you up. You always have a very low risk of any sort of nerve injury anytime you have surgery. And when we put implants in your knee, again, very low risk of loosening or failure of that implant over time, which would require a revision surgery. There's always a chance that you have some residual pains or stiffness after surgery. Now, keep in mind, our surgery is affecting the bone, but it's not necessarily changing all the soft tissue around your knee. So sometimes people can have some residual pain around the knee due to some inflammation and stiffness, especially if you don't get this thing moving right away with physical therapy. Very small risk of fracture, which would be addressed during surgery. There's also risk of clicking. It's very actually common for mechanical components to click when you walk, and as long as it's not accompanied by pain, it's actually not something that we worry about too much. And then lots of patients actually get some insomnia after surgery, especially after undergoing anesthesia, but that should go away with time. So you've been scheduled for a knee replacement. Now what do? What's super important right from the get-go is making sure that you've called your primary care provider to tell them, hey, I'm having a knee replacement. I'm going to need some medical clearance. Sometimes your primary care doctor will want to see you for an appointment, and sometimes if they've seen you recently, they're willing to just sign off on a medical clearance. This does need to be done within 30 days prior to surgery. So if your surgery is not scheduled for another 3 months, don't rush right out and get this done, because then it might need to be redone again. So within 30 days of surgery, make sure that your primary care doctor is aware you're having surgery and check in and see if they need to see you for this medical clearance. If you have a cardiologist, you will also need a cardiac clearance. So same rules apply here within 30 days of surgery. Now, these clearances are required by anesthesia. So if you do not get these clearances, they will not put you to sleep, and therefore we cannot perform surgery. So make sure that you've called both your primary care doctor and your cardiologist if you have one. As far as medical equipment that you're going to need, the most important thing is a walker. You're definitely going to need this before surgery. It will not be issued to you by the hospital or the surgery center, so bring it with you the day of surgery. As far as walkers are concerned, we want you to get one with 2 wheels in the front and no wheels in the back. This is for stability's sake. If you get one with all 4 wheels, especially if you're not used to using a walker like that, it can just slide right out from underneath you and put you at risk for falling. So make sure you get your walker. You can either get that from us. There's also Target, Amazon, Walmart, and one of the cheapest options would be to go to one of our local thrift stores like Goodwill. There you can often find the cheapest walkers that have barely been used, and a lot of people find that that's a great option. As far as medical equipment that you may or may not want to purchase, things like a cane, because often people transition from a walker to a cane, a toilet lift if your toilet is really low to the ground, a shower chair, and possibly even an ice machine. And we'll go over icing in a few slides. If your surgery is scheduled at our outpatient surgery center right here at Coastal Orthopedics, you will need to make sure that you've done your lab work and your EKG. Often your primary care doctor will do this for you, but if they have not done it for you, you definitely need to let us know so that we can order it for you. If your surgery is being done at the hospital, then the hospital should be contacting you about a pre-op testing appointment where they will do all of this for you. So that way it's right in the hospital system. If you are getting close to surgery and you have not heard from the hospital, definitely give us a call so that we can make sure that this has been scheduled for you and that it doesn't kind of fall through the cracks. Now, one of the biggest questions we get asked is about icing after surgery. Icing is super duper important. It's something that at the beginning, at least in the first 2 weeks, we recommend doing as often as 20 minutes on, 20 minutes off. It helps with swelling and with pain, but you'll notice you still have pain on and off and swelling on and off, even up to 3 months out from surgery. So it's awesome to be able to keep icing throughout this process. Now, you can use a good old-fashioned ice pack. If you go that route, I do recommend you get the kind of blue jelly kind that can kind of morph around your knee, and I would get more than one so you can alternate out of the freezer between the two. We also offer an ice machine that you can buy straight from us. It's not usually covered by insurance. It's usually about $175. That is an option. There's also an awesome company called Nice that does rental ice machines. And the best part about these is that they also add compression, which can really, really help with swelling after surgery. And often a lot of patients that rent the ice machine do tend to use a little less narcotics. So it's a really good system. If that's something that you're interested in, you'll definitely want to reach out to us so that we can send all the recommendations to the Nice machine company and they can get you all set up. So what else do you need to do to prepare for your surgery? The biggest thing is that you're going to want to plan for your recovery at home. Make sure you're taking adequate time off of work. For most people, that's going to be at least 4 to 6 weeks. Obviously, it's going to depend on your level of activity at work, but definitely at least 4 to 6 weeks. You're definitely going to need somebody at home with you for at least the first couple of days after surgery to do things like help you in and out of bed, get to the bathroom and back, getting dressed, preparing food, all that kind of stuff. You are going to be unable to drive for a couple of weeks. Now, if you are having surgery on your right side, this is going to be a strict 4 weeks at least, because that is your pedal foot, but you're definitely going to want to have someone set up to drive you to your appointments, at least in that early stage. If your surgery is being done at our outpatient surgery center here at Coastal Orthopedics, we do have a phone number here, and this should also be included in the packet that you received, that you are going to call the day before surgery between 2 and 4 p.m. They're going to tell you exactly what time your surgery is going to be. If your surgery is being done at the hospital, then the hospital should be calling you the day before to give you your exact arrival time. Now, if your surgery is on a Monday, they will be calling you on Friday, and usually after about 5 p.m. to give you that information. So make sure you answer any weird phone calls on that day. Definitely do not eat or drink anything after midnight, the night before your surgery. And then we have a list of medications to stop prior to your surgery. So as far as over-the-counter medications, that's going to be anything in the NSAID family. We're talking ibuprofen, Aleve, Motrin, naproxen, any multivitamins or supplements, aspirin, and then fish oil. If you're taking a blood thinner, it's going to be very important to talk to your primary care or your cardiologist, basically whoever prescribes that blood thinner, as to exactly when it is safe for you to come off of that blood thinner, because it's going to be different for every single one of these. Examples of these are Plavix, Coumadin, warfarin, Eliquis, Xarelto, and definitely speak to them about that. You are still allowed to take Tylenol, Celebrex, or meloxicam for pain prior to surgery, but that you're going to be pretty limited to just those. Now, what's going to happen the day of surgery? So you will show up to either the surgery center or the hospital. They're going to take you to the preoperative area, and anesthesia is going to come by and ask you lots of questions. This is the perfect time, if you have any concerns about anesthesia at all, to talk to the anesthesiologist. If you've had issues with vomiting in the past or anything else, definitely let your anesthesia team know at that time. No matter what they use to put you to sleep, they will also give you a nerve block. So that's where they inject something like lidocaine or bupivacaine over the top part of your thigh. And the benefit of that is it makes the top part of your knee numb. And it can last for up to 24 hours. So it really helps with pain control in that first 24-hour period. So don't be surprised if you wake up from surgery feeling great. I promise your pain is going to kick up the next day after that nerve block is wearing off. And it is not anything that has gone wrong, it's just that nerve block wearing off. As I said before, we will be using a tourniquet over your thigh to help prevent bleeding during surgery. But what that can often cause is a lot of pain and bruising over your thigh. And a lot of times when you get up and start moving around after surgery, gravity may bring that bruising all the way down to your ankle. So it can look a little gory, okay? But I promise we didn't do anything to your ankle, and it's just gravity bringing that bruising down there. So once you do wake up, you'll be monitored in the recovery unit until it is determined that you are ready to go home. And family members will be able to visit you in that postoperative area once you wake up enough to kind of interact with them. Dr. Harkess will call whoever you've elected to let them know how the surgery went before he even leaves the operating room. So make sure that they leave their cell phones on that day. And if your surgery is going to be done at the outpatient surgery center, you'll be discharged home the same day. If your surgery is done at the hospital, you do still have the option of leaving the same day if you're meeting all of our discharge criteria, meaning that you're fully awake, you're tolerating a little bit of food, and you're able to walk with a walker without, falling over or having any kind of instability there. But we do always have the option of keeping you overnight if we need to, which is the benefit of the hospital. So as far as your incision is concerned, your incision is going to be closed with sutures that are underneath your skin that will dissolve on their own, so no stitches or staples to get taken out. We usually use skin glue over top of that as kind of an added layer of protection, and then we're going to use this really nifty dressing called an Aquacel dressing. It is waterproof, so you can shower with it on, and it stays on for 7 to 10 days after surgery. As you can see from this picture down at the bottom, it's very flexible. It should move with your incision. And so at 7 to 10 days, you can absolutely take this dressing off yourself. If you feel uncomfortable, you can always ask your physical therapist, or if you feel really uncomfortable, you can keep it on until you follow up for your 2-week post-op appointment. And I or Dr. Harkess is happy to take it off at that visit. Once the dressing is removed, you're still fine to shower. That skin glue is protecting your incision. I just ask that you don't pick at your skin glue, don't scrub it really hard, just let the water kind of gently run over and pat dry. But the biggest thing we don't want you doing is soaking. So no getting in the bathtub, pool, hot tub, or ocean for 6 weeks after surgery. And then no lotions, creams, or ointments on or within 2 inches of that incision for that same 6 weeks. Definitely also recommend protecting that incision from direct sun exposure. Very important. We all live in Florida here while it's healing, so that scar will be less visible in the future. Now, as far as pain control after surgery, my goal is to hit your pain from as many angles as I can to limit the amount of narcotics that you end up needing to take. So the top 2 medications on this list are your non-narcotic pain medications that I actually am going to want you to take on a scheduled basis after surgery. So we're talking Tylenol, 2 500 milligram tablets 3 times a day for at least 2 to 4 weeks after surgery. And then we're also going to give you, as long as you don't have any contraindications, meaning you don't have any kidney disease or you're not on any blood thinners, we will be giving you an anti-inflammatory. So that will either be Celebrex or Meloxicam. And this will be dosed once a day for 30 days. So Tylenol and Celebrex you'll take no matter what. Now, the goal with these is not necessarily to bring your pain down to a 0 because you just had major surgery, but what they can do is lower your pain level down just enough so that hopefully you won't need the narcotics as often. And that way, as you're weaning off your narcotic pain medication, you still have something baseline in your system treating your pain. So the last 2 medications on this list are tramadol and oxycodone. These are both technically narcotic pain medications, but they are different strengths. They are never meant to be taken at the same time. It's meant to be an either or based on the kind of pain that you're having. So oxycodone is much stronger. That's for severe breakthrough pain. Tramadol is much weaker for more mild to moderate pain. So again, it's going to be an either or based on the kind of pain that you're having, and those can be taken on top of the Tylenol and whichever anti-inflammatory you've been prescribed. Now, in addition to the pain regimen that we just talked about, we are also going to need to give you a medication for blood clot prevention. Now, we talked about this way back when we talked about risks, but for most people, to prevent blood clots, we are going to have you taking a low-dose 81 milligram aspirin twice a day for 4 weeks after surgery. This is an over-the-counter medication. You can just pick it up right from the pharmacy. Now, if you have any allergies to aspirin or cannot take aspirin for any reason, or you have a history of blood clots, especially after surgical procedures, we are going to give you something stronger. Likely that will be a medication called Xarelto, also for 4 weeks, so the length of time is not going to change. If you are already on a blood thinner, then we will simply just restart your blood thinner the very next day after surgery. Now, those narcotics that we just talked about, the oxycodone and the tramadol, can both make you very nauseated and very constipated. I do recommend you always take them with food on your stomach because that'll help with that nausea. And as far as constipation goes, we do ask that you take a stool softener. Now, this is meant to be a preventative medication. This is not meant to treat constipation after it's already started. It's meant to prevent it in the first place. So as long as you are still taking those narcotic pain medications, I do ask that you take a regular stool softener. It's not a bad idea to have something stronger on hand that is more in the laxative family, just in case. And if you already know that you're prone to constipation with narcotics, definitely want to have something stronger on hand. The other things you can really do for constipation are making sure you're staying nice and hydrated and that you're moving all around. So some of the biggest questions we get asked are, what symptoms should I be worried about after surgery? So after a knee replacement, it's very common to get swelling in your leg, to get bruising. Like I said, that goes all the way down to your ankle. Same with that swelling. It's normal for your knee to be warm because there's all kinds of extra activity going on in there to heal everything. Sometimes it's normal to have a little tiny bit of redness around that incision, or if you get a little irritated, if that redness is just in the footprint of your dressing, then likely you just had a slight reaction to the dressing itself. As well as a low-grade temperature. We're talking anything below 101 degrees. So that is often caused by people being in pain and not taking big, deep breaths after surgery. So if you notice you have a really low grade temperature, any 99, 100, the thing that we would ask you to do first is sit and take some very deep breaths. Take at least 10 big, deep breaths an hour. Try doing that for a couple hours and take a Tylenol. But if you have any of these symptoms and you are concerned in any way, shape, or form, definitely give us a call. We're always happy to discuss, and we're always happy to see you back if you feel like you just need us to take a look. The big things that we do want you to call us back on is if that swelling in your leg turns into major redness and you have a lot of pain in your calf. Any fever is greater than 101.5, definitely let us know. Any significant drainage from your incision, pain that is uncontrolled with your pain regimen, and redness that seems to be getting worse. Give us a call ASAP for any of these symptoms. Now, as far as what to expect after surgery, most people are walking with a walker for about 1 to 2 weeks, after which they progress to a cane or nothing at all. Usually people are starting to putter around town, maybe run a few errands at weeks like 2 to 4, not returning to things like a desk job until about 4 to 6 weeks, and then not playing like a full 18 holes of golf, taking a major trip to Italy until about 3 months out. It is really important that you consider this a full-time job for 3 months. Not because you're going to be debilitated for a full 3 months, but because it's super, super important that you are doing your exercises every single day for at least that first 3 months. 3 months is really this critical period where scar tissue is forming in that knee. And if you don't get up and move, then scar tissue is going to kind of sock things in and make that knee really stiff. So super, super important that you do your exercises. So you will be getting physical therapy after surgery. That will either be with home health physical therapy or outpatient physical therapy, likely right here at Coastal Orthopedics. And then as far as driving is concerned, I mentioned this earlier, but if we do your right knee, then you will not be able to drive for 4 weeks because that is your pedal foot. If we do your left knee, then you can drive as soon as you are off of all narcotic pain medications. So after surgery, we usually see you at some regularly scheduled intervals, as long as everything has gone according to plan and you haven't had any sort of complications. So in the early postoperative period, this means seeing you at 2 weeks, 6 weeks, and 3 months. We do always bring you back at the 1-year anniversary of your surgery. And after that, usually we like to see you about every 3 to 5 years, or obviously as needed if you have any issues at all. So at that 2-week post-op appointment, we will always do x-rays. We're going to check your wound. If your dressing is still on, we'll be taking that off. At 6 weeks is when you'll be cleared to go back in the pool, ocean, hot tub, basically any of those soaking activities. We'll also clear you for putting any lotions, creams, or ointments on that incision. At your 3-month visit, this is usually a very quick, easy visit. Most people are doing great by this time. We will just take one more quick look at you and clear you to see the dentist. At 1 year, we do repeat x-rays. Again, this should be another quick visit just to make sure everything is still treating you well. Now, as I just noted, we'll clear you for the dentist at 3 months. It's very, very important that you do not make any dental appointments within 2 weeks prior to surgery and 3 months after. This includes a cleaning. For the next 2 years after that 3-month mark, you will need a one-time dose of antibiotics every time you see the dentist. Usually your dentist will prescribe these for you, and they're going to know exactly what you're talking about if you tell them that you had a knee replacement. It is usually 4 pills taken 1 hour before your appointment. And if your dentist wants us to prescribe those, we're happy to do that for you. All you got to do is let us know. Now, that's the end of our presentation, but we are very, very excited to be undergoing this joint replacement journey with you. Our team is always available. Should you have any questions whatsoever, you give us a call, and we will be talking to you again for a quick pre-op phone call, and that's where you can ask any questions that came up during this presentation. We're really hopeful that this surgery is going to give you better function and much less pain, and we are excited to proceed with you. Have a good rest of your day.